So just so everyone is aware, we are now recording. You'll, as I just mentioned, you want to make sure they're muting. If you could please be sure not to put us on hold, that would be fantastic. And if possible, don't use the speakerphone on your computer, on your phone, because it just echoes. So if you can just hold the phone to your ear. We, as always, what makes this work is the participation, whether that be using your voice or in the chat box. We've been able to find that both ways with larger groups, even that sometimes the chat box is a nice way to be able to have everyone have their turn. You're also welcome to raise your hand under your the list of participants here at the top, and there's a little
alrighty.
Have the ability to raise your hand there, or you could just type in the chat box. If you're using phone audio, you can take a moment to link to with your computer if you're using both. And the way you do that, if you haven't entered your participant ID already into your phone to link them, under you'll either see this screen, or you can go down, and when you click on participants and see your name, it tells you your participant ID, and you can just bind that by hitting the number sign, your participant ID, and the number sign on your phone again, and that will bind it so that the two go together and we just see one name, and you can mute and unmute using your computer if you wanted to. All right, so I am going to just do the welcome and housekeeping I just did. Today for the agenda, we are going to do a team spotlight and inspirational stories. Take about 40 minutes, and we're very excited for that. I did want to see if at this point Carrie had joined the call. Carrie, are you on board yet? No, not just yet. Okay, well then I'll continue through here. We are going to, moving forward, we're just trying to, now we're really getting into the fun part of really implementing projects and having stories to share. And we've been doing that all along, but this is a time when we've really starting to really gain some momentum there. And so we have the team spotlight and family testimony to be able to share for you for a little bit of ideas, inspiration, a chance for everyone to get to kind of do some cross sharing. And then we're going to do an update on where we're at with the family focus groups and where the planning process is, on-site support visits in relation to that, and the plans and expectations for the state teams. And if you have any questions about that, then we're more than happy to answer them. And then we're going to do some measurement update. Why not? What else? And expectations there. So where we're at with the QIDA timeline, which, as you all know, has been a process as we've been working things out. As with everything else, even with QIDA, they've been saying this is much more complex and involved than the other projects that we've been doing from QIDA. So it's exciting that our project is allowing for that complexity, and it also makes things take a little longer sometimes. So with that in mind, we're going to review the QIDA toolkit that was so graciously put together, and Sherry Leonard was the star for making that happen. Answer any lingering questions in that, and then provide state teams time to ask questions, and then we'll do a wrap up and just get into next steps. So that's where we're at. And I'm going to move on to the next screen here, and I'm just going through and just making sure everyone's, let me just go right here. So the team spotlight right now is Team Wisconsin, and Mary, I don't know if you want to take over and give a little introduction.
Yeah, so we are very fortunate today to have Ariana Kell speak with us today from Team Wisconsin about a project management tool that they're using. And when I first found out about it, oh gosh, it's been probably about 6 months ago, I was fascinated with it and actually had use of it for a little trial period and shared it with my IP colleagues. We're going to look into it a little bit further later on this year, but I asked her if she wouldn't mind showing it to the rest of the group, and she graciously said yes. So I will turn it over to her. And Ariana, I believe you'll probably just need to tell us when to advance the slides, if that's okay.
That sounds very good. So thank you, Mary and Bethlyn and the rest of the national team for the invitation to share a little bit today with you on one quality improvement project platform that we've been using since the beginning of this year. And as Mary mentioned, I was really asked to speak about why we chose this particular platform and how it really assists us with quality improvement project management. My name is Ariana Kyle. I'm with Team Wisconsin. I'm with Children's Health Alliance of Wisconsin, and I serve as the Quality Improvement Director for the Department of Health Services Family Health Section. Next slide, please. Next slide, please. So our team has chosen to pilot this year a program or a platform called LifeQI. So LifeQI is a company based in England, and I would like to kind of qualify my comments today just to let you know that we've really only been using this particular platform since the beginning of this year. So take any comments that I make with a grain of salt. We've been using it for about 4 months now. And for those of you who are involved in Title V programs in your state, we're also using this particular platform to support other quality improvement learning collaboratives supported by Title V. Next slide, please. So in the second half of last year, part of my scope of work was to actually review a series of quality improvement project platforms. So I had time carved out of my schedule to have conversations with users of these platforms, to speak with company representatives, to try a variety of them out. So I did a fairly deep dive into 5 different platforms. And as you would imagine, each had their strengths and their challenges. But quality improvement using LifeQI specifically seemed to be a reasonable approach for us this year for the bullets that you see listed on this particular slide. So the first is that LifeQI uses the model for improvement. So most of you know that there are many different flavors of quality improvement, if you will. There's model for improvement, there's Lean, there's Six Sigma. So LifeQI really has the model for improvement baked into the platform. So those 3 questions and the plan, do, study, act cycle. And you'll see more of that in subsequent slides. So for us, that was an appealing element. A really significant consideration for our teams is that LifeQI really does allow a staff person to easily build out and edit projects. And so for us, this was a significant advantage that someone on our team could input the measures, could input driver diagrams, and could easily input information into the plan, do, study, act cycles. Some of the other platforms that are out there, you are required to go through that organization staff in order to have changes made. And obviously there are some advantages with that too. But for our needs, we really felt like it was imperative that we be able to do that updating ourselves. Sometimes our project measures change, they evolve, and being able to make those changes ourselves in real time was an advantage to us. The platform tracks plan, do, study, act cycles as well as ramps, and we considered that an advantage. It visually displays data, so once you enter a series of data points, it will create a visual display of that. It will start with a run chart, and if you have a sufficient number of data points, it will switch over to a control chart. So I'll show you what that looks like for some very early data. And another significant factor for us was that the pricing around LifeQI was fairly reasonable, and specifically it had a per user cost. And so some of the other platforms, there's really a significant upfront investment for them to build out the platform for you, upwards of $30,000, $40,000, $50,000. We didn't have that kind of money in our public health funded budget. And so this was a good alternative in that respect as well. Next slide, please. So this is just a screenshot that highlights several of the features that were listed on the last slide that were important to us when selecting a quality improvement platform to pilot. And so I'll kind of talk you through some of the different features that are highlighted on this screen. So if you look at the very top menu, you see there's the general page. That's what's pictured right here. There's a menu that allows you to click on a driver diagram, measures and charts, projects, and then the section that allows different team members to have a discussion with one another using this platform. So just a little background information. The organizing framework that LifeQI uses is that what they call a program is that overarching umbrella, and then there are individual projects within that program. So the program is that overarching umbrella idea, and then the projects are the specific activities within it. So if we look under the menu on top, you can see the program team. You notice some of the spellings are just a little different. Again, this platform is based in the UK, and so they spell program with 2 M's, an E and an S, and they're a little biased against Z's. I haven't seen any Z's on the platform, but once you get past that, things will seem pretty straightforward. So you can see some of our program team represented in the circles there with the initials. You see kind of a high-level overview of a driver diagram, and that actually, I programmed that in from this national CoIIN driver diagram, so we have that as a reference. You see the measures as well as the projects that are active under this particular program. And then in the bottom half of the screen, you see the title of the program, as well as the aim of all of our collective work. So we know we're all working together to increase that 25% of children with medical complexity and their families are having those unmet needs met. Next slide, please. So there's a lot of text on this slide, and I don't expect that you'll want to read it all, but I wanted to provide this as an example of what a driver diagram looks like within LifeQI. So this is the driver diagram for one of the Wisconsin team's projects on this national CoIIN. And so one area of focus for the Wisconsin team is we're really looking to increase the number of children that are enrolled in our complex care programs who are also enrolled in a waiver program through our state called the Children's Long-Term Support Waiver. So that's one of our theories that we're trying to test out, is that having children enrolled in not only the complex care program, but also the state waiver program, we think will be a significant way to reduce unmet needs. So you see that when I filled out the project, the aim is actually pulled directly into the driver diagram that's on the far left. And like all other driver diagrams that you see, you have the primary drivers listed next. And again, I populated those in based on team discussions. You can link particular measures to your drivers if you wish. The middle column, or the third column on this slide, is the secondary drivers. And in this case, we've indicated the locations where those drivers would be active. And then really of significance, the rightmost column on this driver diagram are change ideas. So specific test of change ideas that we think if we try them out and gather some information around them, they really might help us move the needle and reaching more kids in the complex care program, also being enrolled in the waiver program. Next slide, please. So this slide is a screenshot that just lets you know how LifeQI is able to capture your tests of change, otherwise known as Plan, Do, Study, Act cycles, or PDSA cycles. And the platform captures those ideas first as a ramp. And the ramps, there are 2 ramps actually featured on this particular slide. They're also called change ideas. And so the first ramp or change idea is the 11-step process to promote enrollment. In this case, it's promote enrollment in those long-term support waivers. And you see, if you look over to the right under that particular change idea or ramp, we've actually conducted 4 different Plan, Do, Study, Act cycles related to that idea. You see there's a second ramp below that that has to do with really referral and release of information to our regional centers for children and youth with special health care needs across the state. And you can see under that particular ramp, there's 1 Plan, Do, Study, Act cycle that's going on right now. And you can see that the P of the Plan, Do, Study, Act cycle is a darker shade of blue than the rest of the cycle, and that just lets you know that we're in that planning stage. Next slide, please. So this slide just gives you a little bit more information on what the Plan, Do, Study, Act cycle information would look like if it's captured within LifeQI. And this slide only shows you the P stage, so just the planning stage. So the title is listed. We're wondering specifically if we let families know what are some specific asks that they might make of the waiver program to help them meet those unmet needs if they might be more motivated to enroll in the program. So that's what we're testing out with this particular cycle, giving families those list of asks that they might make. One of my very favorite things about the LifeQI platform is that within the Plan, Do, Study, Act cycle and within the planning stage, they give you that prompt to make a prediction. And so making that prediction is, of course, one of the really critical elements of changing what could be just a task into an actual test. And so making that prediction ahead of time and writing it down and making a commitment to it, and then being able to check back in after you actually run that test is a really critical piece of making sure that we learn as much as we can from a cycle. So a really nice prompt to help your team remember, yep, we need to make a prediction as part of our planning portion of the cycle. There also is a feature within the platform, and that's circled up top, that says tasks. So it's not shown on this slide, but the platform does allow you to capture if there are specific activities that need to happen related to that test of change. You can document it. You can note whose responsibility it is to accomplish that particular task and by when. So that's been a useful feature as well. Next slide, please. So this slide shows you how data is visually displayed within the platform. This is a very early form of a run chart, just 2 data points on this particular chart. So just at the very beginning, and the font is very, very small. So it's hard for you to see, I understand that. But the point was just for you to see that if you were to input the numbers, the platform itself automatically creates these run charts for you, so you can see your data displayed over time. On this slide too, you can see that there's that nice red prompt that our data is overdue on this particular measure. This is the number of kids who are enrolled in both the complex care program and the state waiver program. And we're struggling a little bit with our state partners to have them understand the importance of us having this data back from them. So those conversations are ongoing, but the platform gives you that nice prompt of, oh, yep, there's data that's due. Once you have it, you essentially just enter those particular data points. So in this case, it would be the date that you entered it and the percent of kids that are enrolled in both programs. And then the platform, again, will update your run chart for you. Next slide, please. So how LifeQI has helped in project management. So as you saw, there are portions of the platform that really help you track Plan, Do, Study, Act cycle ramps and the cycles themselves. You can essentially track the associated tasks, which can be helpful. We have at some of our meetings that we've used the online meeting platform Zoom, we've been able to pull up the LifeQI platform and do kind of updating of information in the platform in real time. And so that I think has been a help in terms of capturing the information just as that conversation is occurring. And we all know that we're really, really busy. And sometimes those small details like Plan, Do, Study, Act cycles, they can be easy to lose, you know, amidst of all of the other responsibilities. So LifeQI can assist with that. It obviously displays the data visually when you have at least 2 data points, which can make data interpretation faster and more efficient. There is a team discussion section, and it can keep the majority of quality improvement project-related information in one place. Next slide, please. So, as I mentioned, we've just been using this for a little over 4 months now. So our initial impressions are that certainly it is not perfect, but it does appear to be reasonably solid and is meeting several of our learning collaborative needs for not only this project, but other Title V supported work. There are some differences, of course, between American English and British English in terms of the spelling, but if you have your cup of Earl Grey next to you, usually those are easy to get over. And I think early impressions are that it can be particularly helpful for those of us who have quality improvement specific responsibility as part of our role. So last slide is just my contact information. If people have any questions after today's webinar and you'd like to have a conversation about the platform, I'd be happy to do that. I am not a member of the LifeQI staff, however. So if you have more in-depth questions or are wanting to know more about the cost of the platform, I'd be happy to connect you with someone from the LifeQI organization as well. So thank you for your attention.
Great, thank you so much, Rihanna. We really appreciate your time. Mary, I'm gonna unmute you. I don't know if you want to facilitate from here.
Yes, how are we doing on time? I want to check that first.
So we are exactly on time, but we take if there are any questions that people wanted to throw in the chat or ask Ariana before we continue, then we'll do that first.
We can take a minute or two.
Yeah.
So I see that Meg chatted in a question
Yes, she did.
about, yeah, so how much quality improvement experience would, say, a project manager need to use LifeQI effectively? So that's an excellent question. So I would say more than, I would say just the basics. I would say just a little beyond that would probably be helpful. So the platform is organized such, like the measure section, for instance, it allows you to detail out your family of measures. So to have that project manager be familiar with how does an outcome measure differ from a process measure, different from a balancing measure? That kind of understanding would be helpful, I think. Having someone understand the basics of a driver diagram and how to think about how to organize that information, I think would be helpful. We do have several different project managers and directors within Children's Health Alliance using LifeQI this year for the first time. And I would say for the most part, the process has gone fairly smoothly for them. And we're relatively new as an organization to using quality improvement tools. So I would say overall you need some, but not, I would say, a tremendous amount of quality improvement training to use the platform effectively.
Okay. And I felt like the same with you, Ariana. I felt like it would be nice to have a background, but some of it too is just getting used to how to input things, how to, oh yeah, Bethlehem wants me to be on camera. I'm like, no. How to, just get used to entering the data. Where does it go? How to use the reports. And then once you get used to that, I found it fairly to use. Rhonda was from Minnesota, was interested in the pricing aspects. Did you buy several licenses, and how did that work out?
Yeah, so we did. And actually, we bought a series of licenses through my employer, which is Children's Health Alliance of Wisconsin. And so we have 7 different initiatives under Children's Health Alliance. And the more licenses you buy, the cost goes down. And so I'm trying to think of the total number of licenses we have now. Oh boy, I would guess at least 30 to 40 at this point. So that has helped. The more you buy, obviously, it's like bulk pricing. It's like Costco, right? The more you buy, the less expensive it is. But even with a small amount, because I was the first one who kind of decided that this would be a good thing for us to try to pilot, the price wasn't prohibitive as compared with some of the other platforms. Like I said, some of them you had to pony up at least $30,000 just to get a platform built out. And for us, we don't have that kind of discretionary fund. So it was a reasonable cost per person, even with less than 12 licenses.
Okay. I also felt during the trial period that I did. They had some tutorials, and they didn't hassle me when my time was up. I mean, they sent me a couple emails. Did you know your trial period is ending soon? But I didn't feel hassled, which was nice. But so those of you who might be interested in it, Ariana, I'm sure you could, if you reach out to her, she could send you a link or some sort, and you could see about doing a trial if you're very interested.
Certainly, I'd be happy to do that.
And we also had a suggestion from Meg that without a doubt the coaches could also discuss this with anyone on the coaching call, just in general, considering if any team wanted to consider some similar sort of platform for project management.
Anything to make our lives go a little easier is always nice. but I'm kind of geeky around QI, as y'all probably gotten to know that. So this was definitely something I found to be very, very fun and useful. And it seemed like the team liked it too and embraced it. And that's important too, because you don't want it to be something that just you're using. And maybe that's all you need is for you and your own project management. But I thought it was really even better that the whole team could embrace it and look at it and have input into it. I thought that was a valid feature of it as well. All right. Well, if we don't have any more questions, you know how to get up with her. And thank you again for sharing that. I knew that everybody would find that very impressive.
My pleasure. Thank you for the opportunity.
Yes. Okay, so we may want to advance our slide again, Bethlehem.
Mm-hmm.
Okay, so now we're going to we had our sharing, and now we're going to go into our inspirational story. And just to remind us, why we're doing this. We know why we're doing this, because we have a passion and a heart for children with complex medical conditions and making their care better. But it's always good to hear for those who are recipients of that or work in that or around it or had past experiences, future experiences. So I'm very fortunate now to have Maureen Ben-Scooter. She is on Texas's CoIIN's Family Work Group. And thank you, Sherry Santa, for referring her to me. And so I will turn it over to you, Maureen, and let you talk to our group now.
Thank you. I'm very happy to be here. This is going to be the non-technical part of the presentation. I don't have any slides, but I have a lot to say. When Mary asked me to do this, I thought, oh, I have a few things that I could talk about in, a few minutes. And then when I sat down to go through all the wonderful things that Comprehensive Care Clinic in Austin, Texas has done for our family and what I've observed, the changes I've observed, I filled the whole page with single space typing. So I have a lot to say, and I'll try to summarize it a little bit. But to introduce myself, I am Maureen Ben-Scooter, and I have a 17-year-old son who's been a patient at our Comprehensive Care Clinic in Austin for 3 years. And my son, it does have medical complexity. He, when he was younger, he has at baseline autism and a intellectual impairment, a moderate to severe intellectual impairment. At the age of 12, in addition to those things, at the age of 12, he suffered a choking accident, choked on food, and sustained a severe anoxic brain injury. So in addition to the underlying problems, he now has spastic quadriplegia. He's paralyzed from the neck down and requires a nursing home level of care 24/7, basically. So as I like to say, we run a nursing home in our front bedroom. So that's where we are in our journey. My son has always had special needs, and now he has physical special needs in addition to the intellectual and previous behavioral needs. So we've been patients at the Comprehensive Care Clinic for 3 years, and I will just say that I came to that clinic reluctantly. We had, when George was discharged from the hospital after a very long hospitalization, he was hospitalized for 4 months continuously after his anoxic brain injury. So when we exited the hospital after this long and complicated incident, we were in the care of a pediatrician who knew George prior to the accident. And she couldn't have been more wonderful. She immediately gave me her personal cell phone number so that I could contact her at any time. And if I had a particular request, like for a form to be filled out, she said, don't even bother to send that through the normal channels. Just fax it to me, call me, tell me what you need, and I'll get it out. And then she did something that just was very kind, and that she would come to the house when my son George was too sick to go to the clinic, and would make house calls for him. So that's the level of care that we were receiving when another parent who had her child enrolled at the Comprehensive Care Clinic encouraged me to explore the clinic. And so I came reluctantly because I had to give up that pediatrician in order to have our clinic be his primary care provider. But I did so because our pediatrician was just one person in the system that she was working in, and the only person there who knew my son well. So she was just a team of one really for us. And so if she wasn't available, then I had to have somebody else who didn't know George to interact with. And then the second thing was that some of the care that she was providing, she wasn't getting paid for, frankly. So like the home visits, I asked her, how are you billing for this? And she just wasn't. And I felt bad about that. So about 3 years ago, we switched to the Comprehensive Care Clinic, and it was a little rough at the beginning. The providers were lovely, but they were desperately understaffed. And that kind of came to a head after we had been enrolled for about 6 months. And one of the primary needs that my son has is private duty nursing. As I said, that he needs nursing home level of care 24/7. And I had worked really, really hard to get him on Medicaid so that he could get the private duty nursing. And what happened after we'd been in comprehensive care for about 6 months was that the reauthorization that comes up every 3 months for the nursing, the reauthorization was just ignored apparently at the comprehensive care clinic. It went unanswered. And so then our private duty nursing case manager called repeatedly and was told it would get taken care of, and it didn't. And we came to within 24 hours of losing our nursing because of a lack of reauthorization. It just needed to have a form signed. And so I nearly left. I called the clinic director at that point and had a long conversation and said, and we looked through we had records of the phone transactions, et cetera. And I said, I'll give you one more chance. The nurses, the doctors are so lovely. I think this is a system that can work, but this can't ever happen again. And so I know I'm supposed to be sharing an inspirational story. So that was just the fact. That's how things were. And I'd like to explain how things are now. So things were not perfect. And I think the basic problem was that we were asking too few people to do too many tasks. And the most significant change that I see as a user, as a patient, is the increased number of nurse case managers at comprehensive care clinic. And someone else who has the numbers could tell you, but I think maybe the number of nurse case managers has doubled within the last 12 months. And the change was noticeable immediately. And I've been thinking about how best to describe that. And well, for one thing, the turnaround on the forms, or any kind of contact that I have with them, the turnaround time is down to less than a couple of days. And usually it's within 24 hours, which is just absolutely remarkable. And hard. I think that's hard for any clinic to achieve, and they managed to do it. And so that's the most noticeable, measurable thing that I see as a difference. But then there's an unmeasurable that is even more important to me as a parent, and that is when I reach out to the clinic and I need something that's may seem as unimportant and non-urgent as a prescription renewal for physical therapy, or I need a signature on an update for my son's wheelchair equipment. I never get the feeling anymore that I'm calling and irritating somebody at the clinic, or that, oh, here she is again, the 10th time this month with yet another request. The attitude is changed that way, and that's remarkable to me, and it allows me to feel freer to contact the clinic. So there's sort of a one thing that's quite measurable is a turnaround time, and something that's more intangible is just an attitude. And then I'm just going to look at my notes because I don't want to forget anything. Well, here's a very definite example. My son is 17. George is 17. He'll turn 18 this year in 2019. So we've initiated the guardianship process, so we can become his guardians when he turns 18. And the linchpin to that process is a document certifying that he's incompetent, as they say in Texas. That has to be filled out and signed by a physician in a multi-page form. And our awesome doctor and his staff got that filled out in 24 hours. And when they faxed it back to our attorney, the attorney called me and said, I've never had this happen before, where an office gets this to us within 24 hours. So it's that kind of improvement that's really remarkable. there's one thing that's very helpful to me, and perhaps has always been there, but again, I feel freer to use these different modes of access, is the multiple ways that I can contact the clinic. And so I can call the clinic directly and speak to a live person, and I might do that, let's say if I need a same-day appointment for my son. I can, George has a nurse case manager there, as do all the patients at this clinic. And I can call her directly on her cell phone, or I can text her for something that's less urgent. If I need to speak to a case manager who's on sort of on call for immediate attention, I can call that person. And then I can email our primary care physician. And it looks to me like the case manager also reads those, the nurse case manager. And then I'll get a reply back within 24 hours on the email from either our physician or our nurse case manager. Sorry, I was just reading the chat that came up. So what I do, and I should have prefaced all of this by saying I'm a retired internist, so I have a medical background as well. But that allows me, and I don't know if other parents do it, but I certainly do. It allows me to do some triaging before I even contact the clinic. So if I stop and think, is this urgent? Do I need a reply today? Could it be, do I need to speak to the physician? Do I just need some forms hurried along? So I'm involved in the process from the beginning by sort of directing the urgency of the contact with the clinic. I'll also say my son, for all of his complexity, is pretty stable, and most of my contact with the clinic is not in a clinic visit. It is through one of these other modalities I just described. So those are really important to me, because if I had to make an appointment every time I needed to get some of these other matters attended to, I just wouldn't do it, actually. I wanted to give an example of how I feel like our team includes me as a legitimate, important part of the decision-making process. I recently took George to a couple of different subspecialists for osteoporosis, and I got absolutely opposite recommendations from each of these two physicians. And I turned to our primary care provider at the Comprehensive Care Clinic and said, here's what just went down. Do you have any advice? Do you have any resources or references that I could look at? And what do you think? And so this one took about 2 days, but I got a nice email back from the physician. He pulled multiple reference articles for me to look at, and then gave me a summary of them. But what this indicated to me was that he trusted me to be able to read some articles and, be smart enough to interpret them and make some decisions and come to participate in the decision making here, and something where the data is gray, and subspecialists give conflicting advice, but they're both trying to do the best for my son. So that shared decision making and being treated as a person who's not just an emotional parent, but has a functioning brain and can participate in complex decision making about a medical issue. I'm going to read something that I wrote in my comments as I was putting them together. And it's this, talking about everything I've just mentioned. As a result of all of the above, I have a sense of partnership with our clinic. I have a whole organization behind me ready to help me manage the many aspects of my son's life. And I think, as I mentioned, our previous pediatrician, who did a wonderful job all by herself, was just one person. And now I feel like I have a whole organization. And it's more than just a feeling. When George has an acute problem, when I call in, people know about him. I think that they have team meetings and they talk about their current cases, and that's reflected in that when I call in with an urgent issue, people know who he is, and I don't have to start from scratch, and so I don't have a sole provider who's on their own trying to take care of my complicated kid with me. I've got a whole group of people, a whole clinic. And then I'm going to finish up by sharing some comments from a few other parents. This topic came up in our last family work group meeting, and one of the parents said that the service dog that works at the clinic makes a big difference to her child. So I think about a year ago, the clinic obtained a service dog, and my son doesn't respond that much to the dog. The way he sits in his wheelchair, it makes it hard for him to see the dog, but he's never been a big pet person. But to other children in the clinic, it really can be very soothing and calming for them. And one parent said that instead of saying they're going to the doctor's office, her child says, "We're going to go see Solo today." Solo is the name of the dog, Han Solo. Another comment was that having our Medicaid managed care organization case managers. So in Texas, everyone who's on Medicaid is now served by a managed care organization, which is different than it was a few years ago. And in the population that we belong to, the Medicaid children's program, we've been given a nurse case manager for each child. So at our annual well child checks now, in addition to our physician and our nurse case manager from the clinic, we also have the case manager from Medicaid in the room and involved in the conversation. And that just adds to the comprehensiveness of the care and feeling like everybody's on the same page. And one parent made the comment that the managed care nurse case manager during their annual well child check looked at her and said, "And what about your emotional and psychological needs? Are they getting met?" So that the whole family was being considered, and that having that case manager who had been to her home and seen her child and her setup was involved enough to ask her that kind of question was very meaningful to her. And then we have had at Comprehensive Care Clinic, I think through a grant funded position, it's a grant funded position, but we've had a therapist, a psychotherapist available for parents to talk to and make appointments with at no cost. And I know one parent who reached out and was really helped by that during a crisis time in her child's care. So again, the comprehensive nature of the clinic, and so having a psychotherapist has been relatively new, I think, within the last year or so, addition to the clinic. So that was a bit rambling, as I said, low tech, but I've gone from being a reluctant user of the Comprehensive Care Clinic, where we almost lost our most critical piece of home health, to I'm recruiting people at children's clinics and at schools. I just, do you take your child to this clinic? It's an incredible resource. If you should really look into it. I'm a big promoter because they've really risen to the occasion. So that's all I have. I'd be happy to answer any questions or talk a little bit more. I can talk about my son all day long. So
Maureen, you're wonderful and so inspiring. And You probably didn't get to see it, but I tried to list some of the themes that I picked up from your talk. And Bethlyn actually added another one that, yes, was spot on. And I hope everybody feels inspirational or inspired right now, because I know I do. And I loved even the extra steps you took to speak on the behalf of some other families that mentioned good things to you. And Team Texas has worked really hard on that workflow and bringing those nurses in and you know, working on making it a better experience for all. So you're witnessing that, but I know they need to continue to have your input in that, as all our teams do. That's the big part of this CoIIN that's so wonderful, is having the families, their input in designing better care. So thank you, Maureen.
You're welcome.
Again, for your candidness and honesty, and we appreciate that.
You're welcome.
So was there anyone that wanted to make any other comments or questions you might have? Mary Ann.
Team members are going, you know, your team members there in Texas, you know, they do it all big there. Mary Ann's like, we love our kids and their families. And Maureen, she really loved your presentation, and that she was saying you have a room full of staff here supporting you. So, thank you. She said that.
All right, well, if anyone else did have any other questions or thoughts after, anything that resonated that you might want to follow up on, I'm sure that I could put you in touch with Maureen afterwards. Yes. Or okay, great.
Good. Thank you for the opportunity to speak. I appreciate it.
Thank you so much. Really appreciate that.
All right. I'm going to leave the meeting. Enjoy the rest of your meeting.
Thanks, Maureen.
Bye-bye.
All right. Team Texas is signing off too, and we'll check the recording. Thank you. All right. So we're really appreciate that. We're going to continue with those kinds of stories so people can see how some of the changes that you're making, what those translate into when we're talking about child quality of life and family well-being as part of the outcomes. You can see and really feel it in Maureen's sharing. We hope that hearing that will help us keep our eyes on the prize for those times when we're all we know what we're going for. And it's just trying to find the ways to get there, and at different times things gel and for different teams. And if you did have any questions too, it's also cross-sharing, so it's just an opportunity to see what might resonate for your team. I think everything like that. And we got a great job. Thank you, Alabama. So I'm going to now move into and try to go through a little quicker, because we kind of wanted to make sure we had time for those sharing presentations, but now we're a few minutes behind. So we wanted to give you a sense of the family focus groups and what's the game plan. We've kind of been talking about this, but first and foremost, just to know, they're going to be conducted annually at the state team support visits, and going to be coordinated by each state team with a state team facilitator that's a family representative with a BU co-facilitator. So right now, as you all know, we've been planning those visits June to August. As far as we understand, our first visit right now is with Team Massachusetts, June 4th and 5th. And we're obviously right now finalizing those dates. And are hoping to be able to put a hold in your calendar or whatever we may need to ask you about as we're trying to put this Jenga puzzle together by Wednesday. So everyone is aware of that, just so you know. So thank you for your help in doing that, and for holding on to those times. We know that is a Herculean effort. Herculean. Anyway, so we are working to finalize those questions before June 4th and 5th so that those are all set. And what we're going to do then is BU's going to bring back the recording from the visits to home base for qualitative analysis. We're going to take all the identifying information, remove that, And then the de-identified transcripts will be shared with the state teams, so everyone can see the transcripts and garner information from those and check in with what's going on for and other sites, and just really, again, a form of fostering that collaborative cross-sharing. And we'll do that in a timely way so that it can help the state itself improve their interventions, and then for you to be able to, as they come in through August, you'll be able to also take a look at others. And then we'll do an annual summary so that we can try to pull out whatever we can. And then we'll also have an end of project report based on the network level qualitative analysis. So that's kind of where things stand. I'm going to go to the next slide and then take questions so that you get the full picture. So I'm sure that there are still questions in mind, so let's see if this helps answer. So as far as the specifics of the family focus groups and what this looks like, we're currently developing, we have a process. The family focus group, the work group has really been an excellent group with so much engagement, participation, energy, and just thoughtful and rich, complex feedback. And so we've been taking all that through. We've had 3 meetings, and then we are now doing kind of a shared workspace process to go through some possible questions to vet those out. And we're going to have today, I just sent out what we had scheduled, a drop-in open office hours, so people can either do written, they can verbally provide their responses. So that's all happening within the family focus group work group. And then we will also provide, so we're going to have a final group of questions. It's 3 to 6 questions within the domains of family well-being and child quality of life. So that's our goal in the end, and we're going to get there before we have to use them. And we'll have a script as well, so that the facilitator isn't just going in and trying to figure that they'll have something they can follow without needing to just make that up. And at most, you don't want the sessions to last more than 1.5 hours. People really start to check out. It just ends up being too much after that point. So from start to finish, you don't want it to be any longer than that. We want 8 to 10% participants. That's a sweet spot for anyone that's aware of focus groups. 10 is the absolute max, as much as you might love to have more. And at this point, we're planning to do 1 focus group per state team. So if you had other considerations, please let us know, but that's our plan. And then we'll be able to provide participant stipends. And then when we bring that recording back, oh, it looks like we have some stuff that's the same from last time around, from the last slide. Sorry, I didn't catch that before. So we'll be able to make sure that they're, just again, reminder, all that identifying information will be removed. And then those transcripts will be shared out without any identifying information. And then we'll be able to provide that some summary of the information too, so that you have a way to be able to look at it quickly. So that's the idea, and I wanted to see if anyone had any question. Yeah, Alan's asking about the amount for the stipends, and I have to say that Meg and I haven't had a chance to connect. She actually had a very well-deserved vacation last week. So I was putting this together knowing that I was going to need to figure out exactly how that would work. The focus group moderator is a question from Rhonda. So I will distinctly get back to you all about the stipends. If you had something you wanted to mention to me, you're welcome to throw that into chat or email me. So as far as the focus group moderator, Rhonda, it is whoever your state team decides is a family representative, preferably, let me just see something here, because I feel like there was another slide. There we go, I'm so sorry. I knew something was missing. There ended up being 2 slides together that I didn't expect. So you will designate your family leader or facilitator for the focus group. Preferably, you'd want them to have experience if possible, and it's optimal if they're the one that's able to recruit participants, just as a way, because your team is going to be the one, you'll be responsible to recruit those participants. And this, Rhonda, also responds to your question. Thank you, because I knew I was missing something when I was thinking of this. Consider your timing. This is going to be at your support visit. So by Wednesday, you'll know the date that from the options that you proposed, which one will be able to work. And then we were thinking that evening is best. The first day of the site visit then would probably be optimal, because we'll be there and we'll be able to do that evening. So that's some of the considerations. Obviously, we want to work with you to try to figure out what's going to work best. And then we've also heard considering the mode for different teams, in person or virtual. We can make both work, and we've heard for some teams virtual will be essential. So that is the gist of it. So we are not at this point considering doing it separate from our QI facilitators visit, but if we are doing it virtually, then I don't see why we couldn't. We were just, I think, trying to make sure that we were doing that in a timely way and that we were able to have everyone's schedule taken into account. So that was just an obvious time at the support visits because we're actually able to make sure that everyone's schedule's aligned as opposed to trying to schedule something separately. So we'd really encourage if we can. I know it's scheduling is just one of those things. And then Meg wanted to know, in your state-specific experiences, what is a typical focus group stipend? So if anyone wants to throw anything in there as far as what you've experienced, we'd be more than happy to hear that. Is there anyone that had any other questions? Obviously, if you have any more, you're welcome to email. All right, so we've got $25 an hour, $50 incentive for advisory team meetings. Ellen, how long are your advisory team meetings usually? 2 hours. Okay, so it's about $25 an hour as well. So Minnesota was $100 stipend for telephone groups last year. Yeah, so Meg did just, as you'll see in the chat, she did just clarify that those stipends will be coming from the BU budget and they'll be available to all family participants, whether it's in person or virtual. We are, of course, happy to talk with anyone individually about this if you're trying to figure this out with your state team, and we'll distinctly talk about it as part of the support visit planning and as you're working to set your agendas. So let's, Rhonda's asking what the focus groups are focusing on. So there were two domains, outcomes that we throughout the process were identified and trying to develop the measures themselves as really needing more rich qualitative experience from families. And those were child quality of life and family well-being. So those are the two domains. And then someone else had $30 for an hour for an in-person interview. So the family rep from the, I'm guessing you're asking Rhonda about the family focus group work group as the facilitator. That's not necessary. That may make sense for your team. I think that we want to make sure that it's a family representative that, if possible, has some experience with doing focus groups, and if they're able to do recruiting, that might really help you out to be able to get your participants. But obviously, if it makes sense, it could be a family rep because they're going to understand the process that we went through and the spirit of the questions, like the essence of what we were trying to get at when we came up with those questions as a group. And then if families have significant travel, and she mentions we also considered mileage in addition to stipend per hour. And Meg recognizes that's a great point. And also, if we have coffee and snacks, if people are in person, that's always something as an incentive and a thank you for people's time. All right, so in the interest of time, I'm gonna move on now. Oops, I'm sorry, there's one more. No, we do want the family group leader to be a family member. It's a family representative. Thank you for making sure to clarify that, Sarah. So if you do have any other questions, feel free to throw them into chat and we'll make sure that we follow up and get them answered. But given that we are a little short in time, I'm going to move us into the measurement section now. And I'm going to advance the slide. This is for measurement updates and expectations. And I believe that Sherry is going to hop on and speak to that. No?
You may need to unmute her.
Yeah, I'm just looking to find her name here. There we are. Sherry, I'm unmuting you right now. There you go.
Can you hear me?
Yeah, do you mind if we start your video?
Okay, let's do it. Oh, yes.
Okay, great.
Yes. Hey, everybody. So we're going to talk quickly about another one of our favorite topics, measures. I feel like we've been on this measurement journey for a while and we're getting near the finish line, believe it or not. So let's just jump in and let's just talk about some updates that's been made, what's to come, and kind of what we expect going forward. So as you can see, our timeline here, and you can see where we've been since March. So we've had some good feedback from several of our teams on the whole data collection and data entry experience. And that comes from Texas, Colorado, and Minnesota, who are our early piloters. So thank you for that. So the feedback that we did get from the teams, we compiled, we looked at suggestions, and then we did what we could do to make the experience better overall. And that's, we had to tweak some of the surveys, we had to update QIDA, we reviewed some of the questions and response options themselves. So a lot of that has been going on in the background. So don't think we're sleeping on the measures. Some things we could do and some things we couldn't do, which we'll talk more on the next slide about. So we're now at the point in the May time point here where we're encouraging every state to complete a small scale testing and then send us your feedback about your experience with the testing. So that can include what you've learned about the surveys, what you learned about giving interviews, if you're interviewing, yeah, QIDA data entry, anything really. So, and when we say small scale, we mean just, 3 to 5 families completing the survey. And if you don't already know, we do have a template for you to use. It's our PDSA template. So I'm not sure if you're familiar with it or where it's located. So what I'm going to do is I'm going to put a link in the chat box right now. And you should see it. It says measurement guide and checklist. So, and if you go to Appendix B there, you'll be able to see the template that we use for piloting. So there's a list of questions for you to think about as you start piloting. And there's also a form for you to record your results on there. So just go to that. It's in box and it's in Appendix B. We ask that you do this and give feedback to your coaches between now and our timeline says May the 10th. So I think we're trying to stick to that as close as possible. I'm not sure if anybody has not had a chance to pilot. If you have not had a chance to pilot, would you mind just typing in the template, the chat box if you have not had a chance to pilot, if you don't mind doing that, or just sending your coach and let your coach know if you have not had a chance to pilot. Once everything is kind of finalized based on the feedback that we get from this pilot as well from the small scale, then we'll do the same process. We'll compile it, we'll look at it, and we'll see what needs to be changed and tweaked. So just as a reminder, we're doing things in data cycles, and the cycles are 6 months each. And in each 6-month cycle, you have to complete 40 family surveys and 40 staff surveys. And toward the end, from now to the end of the project, we're probably looking at between 9 to 10 cycles. So as you get into QIDA, entering data, you'll probably see 9 to 10 points on your charts for the whole project. And we'll generally let you know when each cycle begins and ends. So our first cycle is looking like it may be between May 21st-ish to June-ish, begin date, and 6 months down the road, all the way into about November. So you have all this time to get your 40 family and staff surveys into QIDA. So that's what our timeline is looking like. And of course, we'll keep you updated as we learn more. And of course, and I want to give a big shout out to Kristen from AAP. She's been working really hard with us, getting QIDA ready for us to go. And just let us know if you have any questions about the timeline or any concerns about doing any small scale piloting. Next slide, Bethlyn. So as promised, here are some of the updates that we've made from our early piloting from our 3 groups there. So you can see we have gone to a manual close. So what does that mean? So it means that we previously had an automatic close, which meant QIDA would open and close each cycle automatically for the 6-month period. So now we've moved to a manual close. We did this in order to allow you to monitor your data more closely and frequently in the 6-month cycle. So in QIDA, you can't view your run charts as long as the cycle is open. So if we left it automatic, then you couldn't see it until the end of the 6 months. So we changed that to make it manual. So by allowing you to close your cycle, you can view your run chart at any point in time, whether you have all of your 40 surveys in or not. Monitoring your data will also help alert if you need any changes or improvement efforts sooner rather than later. You can look at your data with your coaches also to determine if anything is needed or missing, or if you need to change something in your process. So that's what allowing you to manually close it will do. But the only thing is, once it's closed, then your coach will have to go in and open your cycle so you can enter the rest of your surveys. So that's kind of what that means. Also, we have moved all the composite measures to the end of QIDA. So this is another thing that may take a little bit of explaining. So our composite measures you won't see unless you're entering data into QIDA via your aggregate data entry. So those of you who have done it, you kind of know what I'm talking about. But if you haven't, these are the measures that are composed of 2 or more questions from the survey. So each question has an acceptable answer. So we have a response that we're looking for each question. And if a family gives all this acceptable or the responses that we're looking for all the questions that make up the measure, then it's counted and it will get displayed into the run charts into QIDA. So for more information, and I know this topic can be a little confusing, I'm also going to add a link in the chat box here to kind of that explains the composite measure component as well. So you should see it there. It says the Composite Measures Guide for Calculations and Instructions. So just look that over, and it kind of goes through what the composite measures are and kind of gives you an example so you know what to include and what not to include. So in addition to this, there's also a workbook. So it's a multi-purpose Excel workbook is what I call this, like QIDA in Excel form. So it helps you manage and store your data, but it also helps you calculate your composite measures as well. So I think I will enter that into the chat box as well. So these are just things. So you just grab these links and you can look at this and see what makes sense to you and what doesn't make sense to you. And then we could talk about it, talk with your coaches about it. We're all in contact, so we can all just talk about it. And the other things that were done, as you can see here, our child age now goes to 26. Originally, it went to 17 years. We have preferred not to answer for all demographic questions. We had to reorder some of the response choices for some of the questions, and some skip patterns and NA options were added as they were needed. So one of the things that I know that was requested that we couldn't change was the numbering in QIDA. So, you know, on the survey, I think it starts with the age as number 1. We couldn't get it where the age was number 1 in QIDA because it asked for other questions before the age and they had to be numbered, so we couldn't start with 1. So if you're wondering why that still looks the same, that's the reason why. So that's it in a nutshell. So we'll see if we get other things based on other feedback as well. So next slide, Bethany.
Sure, just one thing on the numbering, you did create kind of a crosswalk so that people would be able to, within the, as they're looking at their measures calculator, that whole set of worksheets, there's also somewhere in there, there's a crosswalk for numbering.
Yes, it's actually in the QIDA toolkit. I think Nandini might have done that.
Great.
Yes, I think she went through all the platforms. So it was QIDA, it was RedCap, SurveyMonkey, and the actual paper survey itself. She went through and kind of did a crosswalk on what number the questions were for each one and kind of trying to match them up. So if you wanted to look at that document, that's also in the toolbox as well.
Yes, she's nodding. Thank you, Nandini.
Okay, so on the next slide, we kind of have our family and staff survey expectations, which I kind of mentioned earlier. So 40 family surveys and 40 staff surveys. So 40 is our magic number every 6 months. and then we're going to do a manual close. And as we get to it, we can practice more, because I know it might not mean anything much until you start working in QIDA. So that's what we'll be here for, your coaches and all the staff actually, to help you get through this process. And once we do it 1 to 2 times, it should be pretty easy, pretty simple to get through. So, and you can see what the teams are responsible for, and what the collaborative, what we're responsible for too. So you will see in the QIDA toolkit as well, we have some templates there. We have Spanish translations of the survey. And so you can kind of see, we'll go talk about it in a few minutes. Okay, the next slide, Bethlehem. Okay, so all the links that I have provided in the chat box, they're all in box in a folder called the QIDA Toolkit. So you can kind of see it here. And I will actually add the link to the actual toolkit itself here too. So as we're going through it now, you can actually go through it as well with yourself, by yourself. So the first folder you will see there is the Family and Staff Data Collection Surveys. So we have here the paper surveys along with the Spanish version of the family surveys. So take a look at that, and we'll keep the most recent version of all of those in this folder as well. So if you ever have a question about that, just go to this particular folder in the QIDA Toolkit for the most updated version. And I try to keep the dates on them too, so you can kind of see when they were updated as well. The next folder is our data entry tools for QIDA folder. So this will include like the data and the measures calculator that I mentioned earlier, provided that link for there in the chat box. And it also contains a quality control check that you can use in QIDA as well. So the quality control check, it has like predetermined data that's been tested by us already. So you will put in the small sample, I think it's 6 surveys that you can enter in QIDA, whether you're going to do individual charts or aggregate. They're both there in Appendix A and Appendix B. And all response options are there for you to add. So it details everything that you should add into QIDA. And in the very end, you'll have the results. That you should have the same results as we have. So if you haven't played around with QIDA, or you just wanted to make sure that you're getting everything right, then I would suggest starting there. So in the QIDA data entry tools there's a QC check there. So check there. And then other items that's worth mentioning, other great resources are in the QIDA tips and guides folder there. Hopefully that'll guide you and answer any questions that you have. So check out that folder. And coming soon, we're hopefully going to have a nice tutorial video showing you how to navigate and enter data into QIDA. So just click that last link that I just sent and just explore that toolkit. Let me know, let our teams know if you have any questions about anything you see in there. And as you go through QIDA, if you have suggestions, you have feedback, you have something that's not right, then definitely let us know so we can make sure we make this the best as possible and get everything updated. Okay, the next slide. So I guess we can use the next few minutes for you to ask questions if you have questions about anything measures or QIDA related, data collection.
Yeah, I think one of the things that we were thinking is some people have started to get into it. If you just have any suggestions from your experience so far. We'd love to be able to just have anyone's tips as you're really, when you've been looking at it, you're like, look, here's really, this is how our process has gone. Here's what we're doing. Here's the best way to get it in there. Or here's the whatever, or the biggest thing that you're having trouble with would also be really helpful for us, or any of the questions that people might have, anything like that. Or Sherry, is there anything else that you're looking for?
I think there are some questions in the chat box asking about templates for SurveyMonkey, RedCap, and then Spanish versions of those, electronic versions. Or is there any information on that?
People, in the last project update too, we mentioned this, if people email them, we'll be able to send them along. The Spanish versions, based on the most recent changes, just got to us this week. So so we now have everything available again. Carrie pointed out that there's a table of contents for the toolkit as well. So when you go into QIDA Toolkit Unboxed, you'll be able to see that. That will help tell you what everything is and what it's for and how you might use it. So it's kind of a guide to help you get through it. And we all do need to give Sherry some major kudos. I'm going to just put my video. Major kudos. Because she did a lot of work. Yeah, so there's a QIDA tip sheet that's in there. If you're having timeout issues, which have come up already, we need to make sure that we, so if anyone hasn't gotten in there yet to start working, be cognizant of timeout issues and trying to deal with that. And QIDA seems to be sensitive, so that there's a tip for that. And we're also using tips from others. So as you feed things back to us, we're able to, Sherry has been keeping track and then adding to the tips. Yeah, Carrie said this too. We're going to be updating the tip sheet as we go. So it's a living document to document your experiences. So you want to share?
And just any suggestions in general. Yes, we keep a track of everything that you suggest. So just know that you're not just saying something and we're not listening. We are listening and trying to find the best way to deal with whatever issues come up. So
Paula said, Sherry, we'll be using your spreadsheet and I'm putting our survey in this week. We'll let you know how it goes. Thank you so much for putting it together. That if you haven't seen the beautiful spreadsheet Sherry created, the composite measures calculator and the measures calculator and composite measures, it's lovely.
Oh, thank you, Bethlehem. That's been going through changes too. Yeah.
Yeah. But one of the things I think you mentioned this before, but as you're going along, reporting back your experiences for yourself will be helpful, so that not just within your group, but for the larger group, and for us to make sure that this is as tightened up as possible, and that we can share along any tips that people find as we go. Because with any system, there are always little quirks. Anything else?
I think there was a question from very early on in the presentation when we started from Mary Ann. Are you still on, Mary?
No, she went up, but I do have it here. She said, I'd like to know where to go to look at analytics of our test data. She did download a batch, but she's not sure she's looking at the right link of QIDA. So I guess in QIDA, where do you go to look at the analytics of your test data?
Yeah, I'd asked the question, what was she looking for specifically? But I'm more inclined to think now that her cycle is not closed, so she's probably not seeing anything.
Yeah.
So that's what I'm thinking.
So what they'll have to do is enter that test data, manually close the cycle.
And we're working on that too.
Yeah.
So I'm working with Kristen on that now. So the last couple of days, because we had it closing after 40 surveys. So we're switching it to not have that 40 survey requirement, that you can close at any time and look at your data. So we're working on that now. And then you should be able to see it in the data entry tool at the very top of that. You'll be able to close it. So more to come on that.
So we'll email everyone once that change is made, so they can manually close the cycle and see the analytics. Okay.
Yeah.
Yeah. Okay. Great. That sounds good. Okay. And Mary's going to take a look after the call. We have been getting some in-depth, excellent feedback that's been directly informing our ability to then go back and consider both working within QIDA and little tweaks and changes along the way, and how the survey is being presented too. So.
I think we've heard from most states now. So along with our early piloters, we've also heard from additional states just this past week. So thank you for that.
Anyone have anything else that they've learned as they've been doing their surveys that might be worth sharing?
What to do, what not to do.
Yeah. we've been highlighting things as we go. Like for instance, I'm sure you've all seen Team Texas has been using family leaders as their interviewers, and also in the process, they developed a real training around being able to work with the families on anything that arises in the course of that survey, to be able to work with them as kind of a whole person and all of their needs beyond just the survey questions, whatever else arises, and also to capture that qualitative data. So if you haven't seen that, that came up both in the project update and most recent e-newsletter, and it just could be really helpful tools for others. So as you're moving forward, something to have in mind. All right.
Okay, turn it back over to you, Besley.
Well, thank you, Sherry. We really, there's been a lot of work that's gone onto this part, and we really appreciate that. I just can't even, it's just been excellent, so thank you. So continue to play around to see, that sounds like some people are going to be doing that this week, and we'll look forward to hearing any further feedback and help you refine your process until we do the hard launch of QIDA. And in the meantime, part of what's helping us to get to that point of the hard launch is as you give us the feedback so that we can make sure that everything's working the way we all need it to. So thank you. All right, move on to the next slide. Oh, wait, let me just see if there's something else being said here. Thank you, everybody. We're going to keep up the outstanding work. That's what Meg has to say. And then I'm going to just move on to our wrap up and next steps. So we begin the first full cycle data collection, first 40 surveys due by November 1st. As we were just saying, send any data collection tips to your coach or any learnings that you have, and we can add them to the tip sheets or do some troubleshooting, problem solving to make sure everything's working the way it needs to. This is kind of real-time, real world, how is this going? We really very helpful to get your feedback. Review the evaluation summary. I sent out the email on 4/9. So, and we're going to be discussing that in open office hours on May 15th. It's a special session with Chris Lewis, our evaluator, and Steve Fenton, who's been working with the Medicaid state offices to try to look at how we do the data pulls. Continue to upload documents for cross-sharing on Box. You'll see in the last e-newsletter, we had a lot of cool stuff going up. It's great. And we try to, every month now, we're summarizing what's there, and you can click on it directly to go and see the document, or you can look at a summary that we have posted in the cross-sharing folder in Box. So that's another thing. We're still looking at ways to continue cross-sharing and potential for something like a listserv, but just continuing to foster that for you as you're moving forward to help accelerate your progress and inspire ideas. And then be out on the lookout from me ASAP with your support visit information. Thank you, everyone, for your help in us getting there. Here's the evaluation for you. If anyone has any final questions or lingering comments, please let me know. And I believe that we are going to be at time. So I'm just looking at the time. Yeah, it's 2 o'clock. So we appreciate everyone so much for joining. If there are any last lingering questions, I'm happy to take them. And that is the end of our session for today.
Thanks, everyone.
Yes.
Thank you, everybody. Have a good afternoon.
Thank you so much.